Okay, well, we've been getting a lot of phone calls and some questions from our clients related to the coronavirus. Certainly not here to create any more hysteria or confusion as to what's going on, but what we did want to do was maybe give you some information, and we've brought in one of our strategic partners, Brian Huston, with Outright HR, as to some things you can do as employers. We also just found out before we went live here was that the World Health Organization has declared this as a pandemic. So Brian will be able to talk a little bit about that and what that means now as employers and what you're able to do. And we have had some information and feedback from our health insurance carriers, and they are waiving any fees associated with testing as pertains to like CDC guidelines. So that's something that the carriers have offered up. We also know that there are short-term disability potential plays with this, and maybe some things related to your commercial insurance policies. But I'm going to kick it over to Brian because he's really the expert on these things to give you some pointers and advice today and moving forward as we navigate the coronavirus roads.
Thanks, John. Yeah, as you said, it just got escalated to a pandemic, and that does change some of the material I had been preparing. So this is a pretty crazy intersection where employment laws, insurance policies are all really intersecting in a lot of gray areas. So, we got to be considerate of the ADA, FMLA, OSHA, EEOC, HIPAA actually as well. So,
any more acronyms we can throw in there?
There's a ton of areas that you just need to be mindful of as employers. Right? I think it's important to at least first talk a little bit about the coronavirus. I'm not a medical expert. I should probably also say this isn't medical advice or legal advice
right.
I'm giving. Got to give that disclaimer. But
ditto.
Yeah. The coronavirus, COVID-19, as it's also referred to, it is a lot like the flu, but it seems to be transmitted more easily. And that's really what a lot of our government agencies are trying to prevent, right? So there's a graphic that I think we're going to add to this, but it's called flattening the curve. And that's really the government agency's goal here is not having a ton of people all get sick at the same time. For most people, about 80%, it's a lot like the common flu. You're going to get a fever, but just staying at home, you'll be okay. About 20% of people need to seek medical treatment, but that's normally just getting some sort of prescription to handle it.
Right. Brian, real quick, with it now being declared a pandemic, what kind of liberties does that allow the employer now in dealing with this?
Yeah, so the EEOC has said for years now that employers really can't take the temperature of their employees. There's some exceptions, for maybe food, health, safety, things like that, but otherwise you weren't allowed to do that unless it was declared a pandemic. So as of less than an hour ago, employers now could take the temperature of employees. I'm not really advocating that for my clients, not at this point anyway. For me, I think the most important thing is first just to address it, right? Your employees are all talking about this. They're all sending each other Slack messages. So get out ahead of it. Show them, hey, leadership's monitoring the situation. Just a nice kind of templated email. We're monitoring it here in our location. We're in Kansas City. It hasn't gotten that bad. If it gets worse, we'll take some actions, right? So giving that assurance to your employees, maybe throwing in there some of your leave policies, whether you have sick days, things like that, so they have quick access to it. So that's my step one, is just address it, send a nice email out. Step two is for leadership to get together and really talk about how do you want to handle it if things get worse, right? So that's where maybe some additional insurance policies could come into play. I've heard some companies talking about, well, maybe we won't charge sick days that occur between now and mid or the end of April, or giving some additional sick days, things like that. So
right. Trying to encourage people that if they aren't feeling well, stay at home, get tested, and then as an employer offering an extended benefit to them to keep them safe, but also keep their business safe from further infection.
Exactly, because that's the thing. If you're an employee and I've used most of my PTO already, you might be encouraged to just try and tough it out and come into work feeling a little sick. So if we can get ahead of it and say, no, we're going to be a little more lenient right now, that's a good way to prevent that.
Yeah. Anything else that you want to add?
Well, I did probably want to talk about some the employment law implications that can come here.
Yeah.
So
let's do that.
Yeah. So essentially, you should treat this like you do any other illness, right? But the legal community seems to be in agreement that the coronavirus would qualify you for ADA accommodations, for FMLA leave. So if you have 15 or more employees, you need to make reasonable accommodations. Allowing somebody some unpaid time off is generally going to be a reasonable accommodation. So I'd urge you, okay, somebody uses up all their leave time, don't just fire them if they say they're off for this medical reason. A reasonable accommodation would be to allow them to keep their job for a little bit. So that's the ADA. FMLA, if you have 50 or more employees within a 75-mile radius, there's unpaid job protection, and this would qualify as a serious medical condition for that job protection as well. And caring for a family member who has it qualifies under the FMLA too. So those are really the two biggest ones. And then just HIPAA, making sure you keep confidential information confidential. I've gotten some questions, well, if we let Susie work from home for 2 weeks, don't we need to tell people why? No, you don't. You can just say Susie's working from home for 2 weeks. So don't release Susie has coronavirus. Just say she's going to be working from home for a while. So yeah, keeping confidential information confidential, making sure you don't run afoul with ADA, FMLA are going to be the biggest ones. There's some other workers' comp, unemployment insurance. Those really aren't going to be a big deal. Workers' comp needs to arise out of work. And unless you work in the healthcare field or maybe in restaurants, it's going to be hard to say that's how you got this virus. And it only applies while you can't work. So for most people, that'd just be a week or two. Not a ton of benefits for either of those there.
And we had explored civil authority is a coverage that we'll find on many of our commercial policies, but it has to arise out of a covered peril. And we're not seeing anything in the language there that would actually pick up that time of out of business because of civil authority. So again, I think what you've advised here is really good, and we've got to be careful, obviously, what we say, because nothing is black and white. It's always going to be kind of in the middle. And is there anything else that you could think of now? Like I said, we'll provide some sort of recap to people and have some resources available if anybody needs to call or reach out to us. We'll provide the email and phone numbers to do that. But
yeah, no, I think that's perfect. I might throw on some frequently asked questions and stuff that you guys can add to that too. But
great.
Yeah.
Well, we appreciate working with you, the value of having someone like you as part of our team outside our four walls, as we call it, and the information you provide our clients and your clients is invaluable. So hopefully this was helpful, and like I said, if anybody needs to reach out to us, feel free to do so.